I would like to start off by explaining what velopharyngeal dysfunction is. Velopharyngeal dysfunction, also known as VPD, occurs when there is an inadequate separation of the oral and nasal cavities during speech or swallowing. The soft palate is unable to make contact with the pharynx or the back of the throat. VPD is caused by a structural or functional abnormality of the soft palate and pharyngeal muscles. The pharyngeal muscles lie on the back wall of the pharynx or throat, and that aids in swallowing and speaking. VPD breaks down into several categories, and it is important to identify the cause, which may be due to abnormal movement, structure, or compensatory behaviors. Velopharyngeal insufficiency, or VPI, occurs when the structure is abnormal. Structural defects are most common and are typically associated with a previously repaired cleft palate. The soft palate may be too short to allow the approximation of the soft palate and the back of the throat. There may also be scar tissue, which then shortens the palate and decreases the mobility of the velum. Muscles of the throat may be limiting movement of the palate as well. Velopharyngeal incompetence, also known as VPI, occurs when there is abnormal movement. Abnormal movement is usually caused by neuromuscular disorders. Neuromuscular conditions affect the nerves and the muscles. Velopharyngeal incompetence interrupts the appropriate coordination of muscle movements and the appropriate function. Hypernasality tends to increase in connected speech, making it difficult to be understood. VPI is associated with inconsistent articulation errors as well. Neurologic impairments such as congenital abnormalities, which is cleft palate, and traumatic injuries are among some of the reasons the velum, the palate, can be referred to as incompetent. Velopharyngeal insufficiency and incompetence are disorders that require physical change to occur to the structures in order to increase intelligibility. VPIs cannot typically be corrected with speech alone. There is some sort of surgical repair that must be done, or a pharyngeal flap that can be added. But we can go further detail with your cleft palate team. Velopharyngeal mislearning are articulation disorders, and they are also a frequent source of VPD. Articulation disorders sometimes tend to be behavioral causes, and typically present with consistent phoneme-specific nasal emissions or hypernasality. Almost all patients with anatomic causes of VPD present with compensatory misarticulations to help the speech production. It's important to differentiate between the two types of misarticulations, mislearning versus compensatory. Compensatory is something that you do in order to correct the inability to speak correctly. The results of the evaluation revealed that the child is experiencing velopharyngeal insufficiency. And I found a great YouTube video called 4 Ways to Treat Velopharyngeal Insufficiency, which provides a visual of the internal structures and an explanation of the type of surgeries that can be done, or 4 of the main surgeries that can be done in order to correct velopharyngeal insufficiency. I would recommend, or given that the child has had surgery, I suspect that there may be scar tissue that has formed within the structures. I recommend the family is referred to a craniofacial surgeon or team to be evaluated. Some recommendations that I would give for the family is to help the child with speech therapy in identifying nasal production so that they can learn to feel the difference, and so they can learn to hear the difference in what nasal is versus what nasal is not. It may be helpful to change the volume or the pitch when speaking. you may find that speaking in a softer tone could reduce nasality during speech production. That is it.